Hello friends, I am Dr. Sachin KUBER from Pune city, Maharashtra, and today I am going to talk about small packet big bang. This is the title of my video today, and the topic is very important because many patients visit us and contact us via WhatsApp or any other platform, and they ask us that they have just a small tight foreskin on the penis, or they cannot move back the foreskin and they don't have really any issues in their life, but they want the treatment. Or some people ask directly to me that whether I don't have any problem, should I do any treatment? So I say yes, if you have the phimosis or tight foreskin, the treatment is necessary, because as on today this problem is very small and it will not create any issues in your life as far as you do it very quickly, the treatment part. So what happens when the child is up to 6 to 7 years, he has a physiological phimosis, means when he is in the womb of his mother, he has the foreskin which is attached to the glands. As he grows up to 7 years of age, if it is a physiological phimosis, it will slide down easily. Many people call me that they have a 2-year-old son but his skin is not moving. Then I say to them that this is a physiological phimosis and you should wait at least 7 years for that foreskin to get settled and start moving back and forth. But those who are above 7 years of age and they don't or they cannot move back the foreskin, then this is a problem and it is called as phimosis or tight foreskin. So those patients who have this kind of problems, they should take the treatment immediately, because in the early stages it is a small affair, it is a very small surgery, and removing the foreskin is called as circumcision, and this circumcision will require very less of your time, less of your resources. It is a quick surgery done under local anesthesia in 5 minutes, and you immediately in 1 hour you can go. But imagine if you are scared of pain and you don't do any surgery or treatment for the phimosis, then what happens? This problem grows into very big calamities on your body. When you are young, you try to have sex in this condition, then there are cuts, fissures, rashes, infections and itching, redness. This happens, balanitis, balanoposthitis, many sexually transmitted diseases and herpes infections. This happens. Then there is another entity called as lichen sclerosis, lichen planus, and BXO, that is called as balanitis xerosis obliterans. These problems occur because you just don't care and you don't take care of the penis. The hygiene is an issue, as well as you don't get right time treatment for your phimosis. Also, there are many problems of the cuts and fissures. This produces infection bed in the penis skin. If it continues, then for many years, if you don't do it any treatment, then there are back pressure on the kidney, there are urinary stones, the prostate gland also becomes infected. Many times you can see the stones in the prostate gland. This puts your urinary system at risk. In future, there may be kidney failure. Imagine you are just started getting into trouble with the small problem of phimosis, which could have been repaired or treated in the right time as early as possible. If this person who has phimosis gets married and he has problems in getting his wife pregnant, in that situation this issue is very severe in the life of the patient as well as his family, because the first drop of semen that comes out of the penis during sexual intercourse, that first drop has highest motile number of sperms which can cause pregnancy, but that drop is lost in the foreskin, and because of that there are issues in having pregnancy. other issues I am not able to discuss right here. But due to phimosis, this can happen. When this person grows old, suppose he gets pregnancy, he becomes at the age of 40, and many such patients ask me regularly. They don't have any pain, they don't have any issues in passing urine, they don't have any burning, pain, itching, cuts. All these problems which I have mentioned in my multiple videos, they don't have this problem. And they said, is it really necessary to do treatment for this kind of problem? Then still I say yes, because it is for your life, it is important. Suppose if the person gets human papilloma infection, then there may be formation of squamous papilloma, there may be formation of penile cancer at the age group between 45 to 60. So this is a grave situation, and if it happens, then the only answer for this is amputation of the penis or penectomy. So cutting the part of the penis is a depressing affair for every person. So whenever you have this kind of phimosis or tight foreskin, think again and think that in order to prevent any future complications, you should get proper treatment. As now today, as all of us know, that the ZSR circumcision, that is a stitchless and painless ZSR circumcision, is available in this new devices which give excellent results, perfect blending of the foreskin and no pain. The recovery is quick and fast. You don't have to take rest. So when you have such a advanced technology available at your disposal, you should think about treating this problem at an early stage. Whenever it is treated at an early stage, it prevents the big bang or big problems in your future life. Suppose if you are 25 years old and you are about to get married and you find out that your skin is not moving, then immediately take assistance from the doctor, surgeon, urologist nearby your city, or you can contact us. This is very important. The original ZSR circumcision gives excellent results. Stay away from fake ZSR promised people and get your problem resolved as early as possible, because if you do this, there is nothing like it, and your life will become completely 100% free of cancer in future, because the glans penis is very sensitive and it should be exposed to the environment. If it is the skin is moving back, then it's fine, but if it's not moving back, then it should be exposed. The treatment is focused towards the exposure of the glans penis, because there is a smegma accumulation as well as chronic irritation because of smegma leads to cancer. So the treatment is exposing the glans penis to air, water and the touch of the clothes. Don't worry about sensitivity. It will go down. Whenever the patient comes to us and we do surgery for them, the sensitivity is reduced as per my experience in 15 days with our proper medical support. Now there is nothing remaining as to worry about this problem, but the message, take home message is, if you have tight foreskin, if you are having phimosis, there is ballooning and unable to pull back skin, very hard skin, fibrosis, BXO, many issues are there. Balanitis, recurrent balanitis, those people who have diabetes may have first attack on the penis in the form of balanitis, ulcers, redness, pus coming out of it, many sexually transmitted diseases, many herpes simplex diseases, lichen sclerosis, lichen atrophicus, many issues are there. So if you have this, don't ignore. Take a proper treatment at immediate level. Do not run away from the surgery, because this is for your life. This is important for your life. It will prevent your premature death because of cancer. So remember, friends, do seek proper medical attention and care at the right time, so that in future you will not have any issues. You can always contact us. We are giving continuous medical support and answers and the resolutions, results, medicines, treatments, all these kinds of available. You can contact us. We can guide you properly without any bias. So correct advice, correct treatment, correct diagnosis, that is very important, and right time treatment is very important in every man's life. So thank you friends, that was my take home message. Please like, share and subscribe our channel, and see you in some another video. Till then, be vigilant and take care. Thank you.